Hi, I'm Dr. Faisel Sayed. Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Tonight's topic is family medicine, guiding the way. Now, this is a live show, and we had something for the first time happen tonight where one of our guest could not log on due to restrictions from his Wi-Fi network at the hospital. So unfortunately, Dr. Sterling Ransone cannot join us tonight. He would join us in the next 20 to 30 minutes, but my goodness, I mean, we wouldn't want for him to be rushing from the hospital back home. We're going to reschedule having him come on at a future date sometime. My co-host and moderator of the chat is Dr. Dan McCarter. Dr. Dan, welcome.
Hey, Faisal, it's great to be here this evening. I know Sterling is very concerned that I'm sure he's very fretting that he wasn't able to make it, but I think it's safer for him and these patients for him to concentrate on them as a good family doctor, and we can have a little discussion tonight, and then we will get him back and give him the time that he should have.
Absolutely, absolutely. This happened with me too. I mean, this has happened with me. I mean, when you go live, you just never know what's gonna what's gonna happen. I remember we did the one episode with Dr. Grundy, Dr. Paul Grundy, and at the beginning of the episode, sure enough, my internet crashed, and you all had to take off the show while I was trying to run around trying to get the internet working.
Right, right.
Well, tonight's topic is family medicine guiding the way. In particular, we're guiding the way from the fee for service system, which is a hospital based transactional model, towards a fully capitated system where health is delivered even at the level of the home, but managed by primary care. And the topic is with family medicine. It makes sense for family medicine to be the perfect specialty to guide the way to making that transition. And so I'd like to start this conversation tonight about talking about why I feel that it makes perfect sense. Dr. Dan, I don't know if I told you, I did my residency at an unopposed family medicine program in Columbus, Georgia, at the medical center. And so when we're talking about an unopposed family medicine program, that means that there are no other residents in that program. When you're doing your OB rotation, you're not watching an OB deliver the babies. You're the ones you're the one delivering the baby. When you're in trauma, that's it. You're the one doing trauma. On medicine, we were the ones doing the admissions. And so when we're talking about making this transition away from what we have right now, pre-COVID, half of medical care in the United States was delivered in the emergency room setting. We have a very heavily hospital-based healthcare delivery system, and even if it's not being delivered in the hospitals themselves, the hospitals own a huge percentage of the practices, both specialty and primary care practices. So family medicine is right to make that transition because we were trained to provide complete care. We were trained to be the ones to do the prevention, to offer the early intervention. We were trained so that um, we wouldn't have to rely on specialty care unless you needed someone really to do uh, for an intervention.
Right, and I remember one of my mentors, as a when I was a resident, was talking about family medicine was the one specialty that you could potentially practice without electricity if you had to. I mean, we still know the art of physical diagnosis and know the art of talking to the patients. Now, granted, during COVID, we've moved so much to the computer, but it's still about that relationship and being able to talk to the patient, to examine the patient. And the other thing that's important, especially I think if Dr. Ranson was here, he would comment on this, is family medicine, the specialty societies, really the only completely primary care specialty society at the national level. I mean, you certainly have a lot of primary care pediatricians and a lot of primary care internists, but family medicine is all primary care, and so he, as the president of the AFP, will really be taking the lead with that. So I think, and you're right, as you're moving to value-based care, and it inverts the pyramid, right? I mean, people really think about the family physician, the primary care physician, as being the loss leader, the milk in the back of the store, if you will, for the fee for service. And when you turn to the value based care, then all of a sudden the primary care physician is the one with the relationship with the patient, one helping coordinate their care, one coaching them to make the better life choices, and then they suddenly become the most valuable commodity, specialty, if you will, and the partialists then become much less special as you go forward. So I think it's a great time to be a primary care physician, and especially if you are learning about managing risk and moving to value based care.
Yeah, in the fee for service world, what most people think when most people think of primary care, they think of wellness visits. They think this is a doctor that I go to get my medications refilled. This is the doctor that I go to get my referrals to go see specialists. I mean, that's what most people think of when they think of primary care these days in our fee for service system. And and really, and then when you think about prevention, when people think about what if there's a medical emergency, or there's an outbreak, you think of public health. So public health is its own space. This, if you need a refill or a referral or a wellness visit, that's primary care. If you need active intervention, if you need to get an antibiotic or you've got pain that doesn't require an emergency room visit, people think of urgent cares. They don't think of primary care being a combination of all three of those. And in fact, we have primary care doctors who aren't they're getting trained in family medicine, internal medicine, especially with family medicine, and they're not even going into the outpatient setting. They're working in places like urgent cares. They're working in emergency rooms. They're working as hospitalists in the hospital. So it's almost like when making the transition to this healthcare delivery system that's based from the home, managed by primary care in a capitated way, it's like taking things back to
Right.
the way it used to be.
Well, but I mean, I've heard it said health doesn't happen in hospitals, and I think a lot of us, go into medicine because we enjoy science, we learn about the science, and but at the end of the day, if you've got, if you got sickness over here and complete health over here, well, the best you ever get in the hospital is about halfway to health, right? Because you don't leave people in the hospital until they get healthy. You don't put them on exercise programs, and you might do some diet teaching in the hospital, but that's a very artificial situation. It's not. I mean, I think today you were telling me about, at one point you took a patient to the Aldi store to help them learn how to shop, right? I mean,
Well,
yeah, yeah.
there's more to that story, Doc. There's more to that story, Doctor Ted.
So,
I wanted to know where the patient was getting his groceries, and you know where he took me before the Aldi? I didn't tell you. He took me to the convenience store.
right,
He took me to a convenience store. Seriously, he took me to a convenience store.
and showed you how he was eating the low salt potato chips.
Yeah, that's what the situation was. I had to see where he was getting it from, and I had to tell him he was on fixed income, like earning $500-600 a month in Social Security, and we had to literally. I had to see where he was getting his groceries. That explained a lot. So the bulk of his groceries he was getting from the convenience store, and then we went together. We went together to to the Aldi's, and actually, the Aldi's pretty close by to most of our centers, and I got to see. I got to show him as well, and it changed his life.